So still moving on the different types of tumor growths in the ovary. I'll be looking at the different examples. So for the next example, what we are looking at is what is known as the Dysgerminoma. Okay, so I think these are just the pictures I brought. This is the histology, and this is basically how, you know, the ovaries will look like. So Dysgerminoma, to me, or anytime I hear this, it sounds to me like something is scattering. Okay, so Dysgerminoma is just a rare, but it's an important malignant ovarian germ cell tumor. Do you understand? If they say something is malignant, that's in the thing have what the possibility or the tendencies to spread to other regions. Do you understand? So it most commonly affects what women in their what adolescent time, alright, also young women. So it's considered the ovarian counterpart of testicular seminoma. That means this type of cancer will occur in the men too, but that one is called testicular seminoma. You understand? So despite its malignancy, it has an excellent prognosis once you will diagnose it early and you apply the appropriate treatments, which we'll be talking about later. So what are the key features? What makes this different? It arises from primordial germ cells in the ovary. Typically, it is present as a solid, fleshy mass with a smooth, buccellated surface. Histology shows uniform cells with clear cytoplasm. This is it. You can pause to read about the histology characteristics. Alright. Often is associated with what? The person will be having high lactate dehydrogenase levels. Okay. So this one too is also what? A marker for the tumor. So if you do some 1 or 2 blood tests and you see lactate dehydrogenase being high in someone that you're suspecting has this type of tumor, it further what confirms it. All right. So epidemiology, age is normally in adolescents and young people, right? The chances of it occurring on 2 sides of the ovary is 10 to 15. You know, the person might have some other issues like Swyer syndrome, Turner syndrome. You know, so it's rare after the age 50. Right? Rarely occur. It's mostly in adults and adolescents. So such a person will be experiencing abdominal pain. The stomach can be swollen. There's a pelvic mass if you try to like palpate there. Irregular menstruation, fatigue or weight loss in advanced cases. So diagnosis, of course the ovaries are buried deep down. So if I want to visualize the ovary, I have to now go inside. Do you understand? I want to image inside. So ultrasound, CT scans, MRI to visualize the ovarian mass. Alright, then I also do blood tests to check if the marker, which is lactate dehydrogenase, the levels are high. Do you understand? Then biopsy to confirm. Treatment is a tumor, it's a cancer, so I'll remove it, cut it out. Then I'll use chemotherapy or radiotherapy to like clear up all the cells that are left behind. You understand?